Today we're going to talk about how to find your Medicare Part D plan. If you have a standalone Part D plan for 2026, it is important to compare in AEP at this time. It is, as you see here, between October 15th and December 7th. And I know some people have gotten really confused. You just go to Medicare.gov. You make sure you click on your plan year of 2026. Enter your zip code. Make sure you pick the correct county that you live in. Hit continue. This time we're only looking at Medicare Part D, which is the Medicare drug plan. Hit find plans. Then it's going to ask you some questions here. It's going to say, do you get help with your Medicare health or drug costs? So a lot of times, as I stated, Medicare Part D is usually a standalone plan. It can go with like a Medicare supplement plan or just original Medicare. So if you also have Medicaid, you want to make sure you click on Medicaid. If you have SSI here, Medicare Savings Program, which is a little bit different than just Medicaid sometimes, depending on the state, you hit here, and then extra help with drug costs. Extra help can also be known as LIS, low income subsidy. If you do not have anything, just say, I don't get help from any of these programs and hit continue. And then it says, tell us your search preference. Do you want to see your drug costs when you compare plans? This should always be yes. You want it to be yes because it's very important that you know exactly what your drug will cost if your drug is on the formulary as well. Many times people are not realizing that the drug can be on the formulary or the list of drugs that's part of your plan this year, but it cannot be on the formulary for 2026. And that is very important to understand. And in order to know that, you have to compare. You have to know the name of your drug. You have to know how many times you take the drug, which is the frequency, the quantity, and then your dosage. So let's put in some example drugs here. Okay, we'll start with this drug, amlodipine. You pick your dosage. So if you take 10, you keep it 10, 5, very self-explanatory. Make sure the quantity limits is correct, because if you take 2 a day, it's not 30 you get in a month, but 60. And then you pick them up every month. If you pick them up every 3 months, you take 6 times 3, 180. 60 times 3 is 180. And then that's what you would get every 3 months. So you make sure you adjust the drug correctly, because the co-payments and the pricing would depend on it. Let's look here at another drug, Xarelto. There is a generic version. If you can take the generic version, you could put that in. It's definitely going to be a less cost than if you take the name brand drug. We're going to keep it at the name brand drug because the generic version does not give all of the dosage options. And let's say we need 20, we take it once a day. And let's see, let's put in something else here. Let's do Ozempic. All right, make sure you have the correct dosage here. All right, and then it's saying how many pens do you get each month? So let's say you get 1 a month. Add that drug. So this is just an example for education purposes only, to give you an idea on why it's important to understand how to do Medicare.gov, to look at your drug formulary or to compare, and make sure you add your drugs in a list. Once you do that, you hit done adding drugs. Then you want to make sure you look at a pharmacy that's in your zip code. It could be within 5 miles, 10 miles, it's up to you. You hit apply. So if you like CVS, you could pick CVS. If you have a special pharmacist that you'd like to go to, and that pharmacy is part of the plan because that pharmacist is nice and you like them, pick that pharmacy name. You could put that in here as an option, and then you could hit find pharmacies. You could pick a few different pharmacies. So I'm going to pick Walgreens and then Costco as well. And then let's go here, continue to view plans. So we want to compare. So it says choose a plan to join. It's telling us again it's prescription drug plans. And here, because we're on Medicare.gov, the way that it's sorting it, the plans basically is by lowest drug cost plus lowest premium cost. Okay, so you can see here, based on the drugs we put in, it popped up this plan first, which is the Well Care Value Script PDP plan. Has the name of the company, plan ID, and also the star rating. You can see here that it's 10 out of 12 drugs, plans that are available. And this one popped up because based on how it's sorted. So you could sort it different ways. Okay. Then if you want to compare how the different pharmacies look for the plan, you'll see the overview. You see what the total monthly premium is, what the deductible is for this plan. And then if you continue going down, you will see the drugs that you inputted on your plan for your plan coverage, okay? The drugs that you take. These are just examples here, okay? I am a licensed insurance agent and broker, but this is just for education purposes only. Drug coverage, you see the package, you see the quantity of the drug, frequency, and then if it's a brand or generic. So you have, here is one generic and two brands. You can see on this plan, all of the pharmacies are preferred and in-network. Okay? So then you can also see the yearly cost by each pharmacy for the drugs. So you can see here, the cost, here, and then here. Okay? And then it'll let you know, as well as you continue to go down, what the estimated total drug plus premium cost. So you can see that here. When you'll meet your deductible. So regardless, whichever pharmacy you go to, if these are the medications that you're on, it'll show you the month you meet your deductible. And then estimated monthly drug costs for the total monthly drug costs. So you see here what the cost is in the first month and then how the costs change. Okay. And so basically here in July, it looks like you're getting to the catastrophic point. And then that's where you have reached your max out of pocket. And then your catastrophic levels, your co-payments are 0. All right. If you have any questions or concerns, it is very good to look here on Medicare.gov to have a better idea of how your drug costs will be looking for 2026, so you're not surprised. Last thing here, star rating. If you want to understand how the star rating works for the plan, you can look here too. I do hope this information has helped. Like I said, this was an example to give you an idea on how to search Medicare.gov to find your prescriptions, to find a plan that will work for you, or to at least compare and see what your drug costs would be for 2026. Okay? So, I hope this is something that was beneficial for you. All right. Have a good one.